Hello, I'm Dr. Jeffrey Brooks, a vein specialist at the California Vein and Wound Center. Today we're going to talk a bit about one of the complications of venous disease, which is phlebitis. Now everyone has heard of deep vein thrombosis, or maybe knew someone who's had that and knows that it can be a scary and potentially very consequential illness. But there's really two kinds of phlebitis that are very separate in their consequences. The first let's talk about would be superficial phlebitis, and that's the kind of phlebitis that people get with varicose vein disease. It's thrombosis or blood clotting within those surface or superficial veins of the legs. Any vein that you can see or feel is a superficial vein. The biggest distinction between superficial phlebitis and deep vein phlebitis is that superficial phlebitis is never dangerous. It never progresses to the things that people think about, such as the blood clots traveling. It really has no long-term consequences or disabilities. It can be very painful. We do at times do some sorts of treatments to shorten the course of the painful thrombosis, but really there is no dangerous outcome to it. The other form of phlebitis is deep vein thrombosis, and that's the thing that people have heard about and known, maybe an aunt, an uncle, or someone who developed deep vein thrombosis and ultimately died or had a significant illness as a result of that. That's a completely separate disease. That is treated very aggressively with anticoagulants, close monitoring, follow-up. It can lead to very significant cardiac and pulmonary complications. That in and of itself is rather rare, maybe 10% of patients who get a deep vein thrombosis, but it does need to be treated aggressively with anticoagulants. And it does have some potential long-lasting functional consequences, and it also increases a patient's risk profile for further episodes of deep vein thrombosis. So while superficial phlebitis is by far and away the more common, and again doesn't carry any dangerous consequences, there is another form of phlebitis, which is deep vein thrombosis, and that can be potentially very dangerous. I'd like to stress at first that it's fairly rare. It typically follows a prolonged illness or some sort of major trauma where there is a lot of musculoskeletal injury. There are some very rare blood clotting abnormalities that can increase a person's risk, but by and large, in a normal, healthy, ambulatory person, it's a very, very rare consequence or very rare entity, and not something that I think a healthy ambulatory person should live in fear of.